Pulmonary ventilation and exchange of gases, step-by-step process. Pulmonary ventilation and gas exchange are essential for maintaining oxygen supply and removing carbon dioxide from the body. Here's a detailed, step-by-step breakdown of the processes involved. Pulmonary ventilation, breathing. Pulmonary ventilation is the movement of air in and out of the lungs. Step 1, inspiration, inhalation. Diaphragm contracts and flattens. External intercostal muscles contract, lifting the ribcage up and outward. Thoracic cavity volume increases, creating a negative pressure relative to the atmosphere. Air flows into the lungs through the trachea and bronchi due to the pressure gradient. Step 2, expiration. Diaphragm relaxes and curves upward. External intercostal muscles relax, and the ribcage moves down and inward. Thoracic cavity volume decreases, increasing intrapulmonary pressure. Air is expelled from the lungs due to the pressure gradient. Note, expiration is usually passive, but during forced breathing, abdominal and internal intercostal muscles assist. 2. External respiration, gas exchange in the lungs. This occurs in the alveoli of the lungs, where gases are exchanged between alveolar air and pulmonary capillary blood. Step 3, diffusion of oxygen. Oxygen concentration is higher in the alveoli than in the blood of pulmonary capillaries. Oxygen diffuses across the alveolar capillary membrane into the blood. It binds with hemoglobin in red blood cells to form oxyhemoglobin. Step 4, diffusion of carbon dioxide. Carbon dioxide concentration is higher in the blood than in the alveolar air. CO2 diffuses from blood into alveoli. It is then exhaled during expiration. 3. Transport of gases. Step 5, oxygen transport. Oxygen is transported, 98.5% bound to hemoglobin, 1.5% dissolved in plasma. Step 6, carbon dioxide transport. CO2 is transported, 70% as bicarbonate ions, HCO, 23% bound to hemoglobin, carbaminohemoglobin, 7% dissolved in plasma. IV, internal respiration, gas exchange in tissues. This occurs at the tissue level between systemic capillaries and body cells. Step 7, oxygen diffusion to tissues. Oxygen diffuses from capillary blood, high O2, to tissues, low O2. Cells use oxygen for aerobic respiration to produce energy, ATP. Step 8, carbon dioxide diffusion from tissues. CO2 is produced as a metabolic waste. It diffuses from cells, high CO2, into tucked blood, low CO2, Step 9, CO2 transport back. CO2 is carried back to the lungs through the venous blood via the same transport methods mentioned. Step 10, expulsion of CO2. At the lungs, CO2 is released from blood into alveoli. It is expelled during the next exhalation. Conclusion. The overall process of pulmonary ventilation and gas exchange ensures that oxygen is continuously supplied to body tissues. Carbon dioxide is effectively removed to maintain pH balance and prevent toxicity. Here are 5 key applications of pulmonary ventilation and gas exchange in nursing practice. 1. Respiratory assessment and monitoring. Application. Nurses regularly assess respiratory rate, rhythm, depth, and effort, as well as oxygen saturation, SpO2, and breath sounds. Importance. Early detection of respiratory distress, hypoventilation, or impaired gas exchange, e.g. in asthma, COPD, pneumonia, allows timely intervention. Oxygen therapy administration. Application. Nurses administer and monitor oxygen therapy via nasal cannulas, mask, or other devices. Understanding gas exchange helps nurses titrate oxygen levels appropriately to maintain optimal oxygenation without causing oxygen toxicity or suppressing respiratory drive, especially in COPD patients. Path 3. Positioning to improve ventilation. Application. Nurses use strategic patient positioning, e.g. semi-Fowlers, high Fowlers, or prone position to enhance lung expansion and gas exchange. Importance. Positioning aids in mobilizing secretions, reducing atelectasis, and improving ventilation perfusion matching. 4. Assisting with airway clearance techniques. Application. Nurses support techniques like chest physiotherapy, suctioning, coughing, deep breathing exercises, and incentive spirometry. Importance. These interventions help clear airways, improve ventilation, and prevent complications like pneumonia or hypoxia. 5. Patient education on breathing techniques. Application. Nurses teach patients pursed lip breathing, diaphragmatic breathing, and use of incentive spirometers. Importance. These techniques promote effective ventilation, reduce dyspnea, and improve oxygen-carbon dioxide exchange, especially in chronic respiratory conditions. Thank you. Have a nice day.